My name is Shelly and I'm here to do the large volume nebulizer competency today. So before I even go into the room, I'm going to review the doctor's orders. Next, I'm going to review the patient's chart, look at their chief complaint, look at the history of their illness, look at their medications that they're on and any allergies that they may have. Then I'm going to gather my equipment. So I have gloves and hand sanitizer. I also have a pulse ox and my stethoscope and a watch. I'm also going to bring in a paper towel, or you can bring in a Kleenex so that if the patient has any secretions, we can use that. I then have the water trap, the mask, the SVN, and 2 pieces of corrugated tubing. So then I'm going to go into the room. Hi, my name is Shelly. I am the respiratory therapist student here at Hartnell College, and I'm going to be giving you your treatment today. What is your name? And your date of birth? Okay, thank you. So the reason I'm here today is that because you're having some secretions and you're having trouble coughing those up, and so I'm going to help you loosen those up today. So first I'm going to put on some gloves. So indications for this would be upper airway edema and also a bypassed upper airway. Some risks and safety precautions, or some risks and things that might happen while we're here is that you may experience bronchospasms or you may get infection. So first, sir, I'm going to go ahead and take your vitals. Is that okay? All right, thank you. So we're going to see what your oxygen saturation is. And I'm also going to take your pulse. So a minute is up, and for 30 seconds I checked the pulse. That was at 45. I'm going to go ahead and double it. So his pulse is 90 beats per minute today. The second 30 seconds I was looking at his chest, counting his respirations. Those were at 8. I'm going to double that, and that would be 16. Next I'm going to, and the saturation is good. It's at 96%. Sir, I'd also like to listen to your lung sounds. Are you in any pain today? Okay, great. I'm going to go ahead and lift you up here and go underneath your gown. Is that okay? All right, thank you. Take a deep breath, please. Thank you. Again.
Very calm.
Stay calm. You go underneath your gown. Deep breath.
Okay. I forget to say that. I know you guys always hear the words.
Even though I'm giving positive feedback.
Yeah.
I'm also going to notate any sounds that you may have heard. I'm also going to note if he's having any trouble breathing, which it doesn't look like he's having any trouble breathing at this time. I'm also going to note any change in his skin color, and right now I see no cyanosis. So then I'm going to put together my treatment here. First I'm going to install the water trap. Now the water trap is here so to catch any condensation that is inside the tubing. So it'll go down the tubing and it'll catch in here, and then there's a little plug here, and that's where you would empty any water.
Well, you're gonna have to do part of the administer screen before. You have to, that's the one where it tells you that's where you're gonna do the scanning, which is your second check. And then the third check is when you
So that is there.
and then when you're done, you come
Just
back.
going to go to the machine.
And then you, yeah, and so that's the third check.
This is going to screw into the wall, to the flow meter.
And you may end up doing it an additional time. I mean, if it's long as you're getting 3. One when you take it out, because think about it. One is when you're looking at the medication. Then you want one when kind of in between. Then you want one, because right now you haven't compared any of that to the actual patient, which happens.
So now I do have this set at 35%. It has a little cheat sheet on the side of the bottle, and so the range I'm going to set the flow meter is at 5. I'm going to attach the mask. So now having it at 35% and setting it at 5 liters per minute, that allows a 4-to-1 oxygen ratio for the patient.
You're in the room, you're talking about the patient and you're and putting it in. And then, because if the patient refuses, and you've already got medication, then that patient gets charged.
And that's up to 5 liters per minute. I'm going to make sure that the air is coming out and go ahead and put it on the patient.
Yeah, then you would put it back in the.
Make sure that the mask is attached. I'm going to pinch the nose to make sure that no air is flowing into the patient's eyes, and also make sure it's firm underneath his chin. I'm also going to give him the tissue in case he has any need to cough while he's having the procedure done, and that way he can spit out any secretions that he may have. That way I can look at the consistency, the color, and any odor. So sir, here is a napkin that you can use in case you need to cough anything up and anything comes out and you need to spit. There you go. Before I would put the mask on, I would also make sure that the patient doesn't have any questions regarding the procedure. And if he did, I would go ahead and answer those. So the procedure takes about 30 minutes, about halfway through. So it's been, let's say, 15 minutes. I'm going to go ahead and recheck to make sure he's tolerating it correctly, not having any problems. So again, I'm going to take his pulse. This time, just for time, I'm going to count it for 15 seconds and then times it by 4. I would then do another 15 seconds and count his respirations and times that by 4. So I'm standing here for about a total of 30 seconds. And then I would go ahead and record those. I would go ahead and record his saturation again. And I would also listen to his lungs, make sure he's not having any bronchospasm. Sir, I'm going to go underneath your gown again. Because he's in this position, I'm not going to go ahead and lift him up again this time because he does have the treatment mask on. So after I do the treatment, I'm going to go ahead and remove my gloves, throw them in the garbage. I'm also going to go and notate everything in the chart, everything that I did, including the percentage and the flow rate, how the patient handled the procedure. If he coughed anything up, I would notate the details with that. Also, I'd notate his vitals beforehand and also during, and if he had any questions. And I think that's it. Thank you.